Hi, I'm Lori Betts. Welcome to Golden Years. This month, my guest is Kelly Rose from Crossroads Hospice. So come on back and we'll find out what they're all about.
Dad, you've been my inspiration. And Mom, I miss you so much.
Type 2 diabetes steals the lives we cherish most. Are you at risk?
You're watching The Fact.
Hi, my guest this month is Kelly Rose, and she is from Crossroads Hospice. And welcome, Kelly. Thank you for joining me on my show.
Thanks, Lori. I'm glad to be here.
That's great. And your expertise is hospice.
Yes.
And I want to tell my viewers a little bit of background of what goes on in the world of hospice.
Okay. Do you want me to give you a little background of like 1960s or when it developed in London?
Oh, interesting.
Came to the United States about 1970 and has been evolving ever since. So the whole goal of making the movement to hospice in the United States was to have a home setting versus an inpatient. Most people prefer to be at home.
In a lot of people's minds, I know when you hear the word hospice, they put up the red flag because they think that is the end. So give my viewers a little bit of updates of what's going on in the hospice world.
Hospice, if you think about it as a gift, okay? It's a Medicare benefit.
In home or out of home, right?
Wherever home is, it could be a skilled nursing facility, assisted living, group home, private residence, apartment, wherever your home is, hospice can come in and help you.
That's good.
Okay? Hospice was initially set up for the last few weeks of life. Normally, the people that utilized it were cancer patients. Well, today, you know, when people utilize hospice, they say, gosh, I wish I would have got this sooner. I wish I would have, once they experience it, they wish they would have had more time to utilize the benefit. But getting people to talk about mortality and death is a very challenging topic to bring up in most homes. We talk about socialization and food and jobs and family, but when we talk about our own mortality, that's a very personal decision. And so when you start thinking about if you have a terminal diagnosis, say you have cancer and you're taking aggressive treatment and your physician says it's life-limiting, then you should look at what your end-of-life goals are. You know, how comfortable, dignified you want to be. What closure do you need? What support do you need? What are your fears and anxiety? That's where the whole hospice team can come in and help.
So, and where does that start? Like, because if you walk down the grocery store, you see all these boxes and brands of cereals.
Okay.
You don't know what to choose unless you have one that you really, really like. So when the doctor says, okay, it's time for hospice, how does an individual really know who to trust, who to choose? Because there's so many of hospices out there now. You know as well as I know, there's a lot of them popping up. So how does the end user decide who's best for mom?
I'm glad that you asked that question because I always say, think of hospice like the term bank. You know, there's lots of different names of banks. And when you go for a loan, you're shopping for your best interest rate, you're shopping for the best return on your value. Think of your choice in hospice care the same way. All hospices operate under Medicare guidelines, but each of them develop programs differently. So call 2 or 3, ask them about things that you desire. You know, if you're gonna stay at home, what happens on weekends and evening hours? Do they send someone out? Do they have staff on call 24 hours a day, 7 days a week? Are they gonna be there when you need them most? You know, when you're in a skilled nursing environment, there's a lot of nurses and aides and support. When you're at home, maybe you've never administered medications before. Maybe you're a little nervous about that. That's when your hospice provider comes in and helps guide you and educates you about what's going to happen, what the medications do. They're a partner to your care, so you should be able to utilize them when it's convenient for you and when you need them.
And through my experience too, I know when hospice kicks in, our medical equipment has to be picked up because we are not a provider for, let's say, hospice A.
Okay.
So I know from experience, the hospice companies make everything happen. You know, if you need the commode, if you need the bed, you guys make it appear.
Absolutely. And normally when someone decides that hospice is going to be a service that they elect, the physician writes what's called a physician order. So they say, yes, you have a 6 months or less terminal diagnosis. Most people, there's about 106 million people on hospice service every year. Wow. 42% of all United States deaths are under hospice care. So people are utilizing the benefit more and more. So if I decide today that I'm going to utilize hospice, my physician writes an order. The hospice company that I choose will contact me and set up a time that's appropriate where I want to meet to do consent forms and to tell me exactly like you said, what's provided, you know, your durable medical equipment, what staff helps with your care. There's usually nurses, state-tested nursing assistants, chaplains, social workers, bereavement coordinators, huge key here to help support the family as this is happening. And we even, with hospice, have volunteers that go and visit. It could be reading, it could be going for a walk,
That's nice.
just personal companionship. Hospice is a supplemental to care. So say you have a non-clinical or non-medical home health company already in your home helping you with your activities of daily living, then hospice is just an additional layer to that care. So more people, more touches. They can help with, the social workers can help with funeral planning.
Oh.
They can help with, maybe there's some closure that needs to help to come with the family.
That's good to know.
You know, a lot of times the patient may be okay with their disease progression and that death is imminent, but the family might have a hard time letting go and adjusting. And that's, the support is for the patient and the family.
And hospice is a range of ages. It could be from young to old.
We, at Crossroads, we have provided care for pediatric patients all the way up to our seniors of 100 years plus, actually. So hospice isn't just a certain age range, it's a diagnosis. And if you're gonna look at quality of life versus quantity of life, that's where hospice comes in and helps. You know, when you look at studies, people on hospice care live 29 days longer than people not on hospice care. Some people actually improve when they come on to hospice because of all the touches of people that come around them. So with hospice, you know, you have to qualify. You have to meet the criteria. So you're evaluated every 90 days. It's called a recertification period. And some people have been on hospice for up to 2 years.
So there isn't a time limit as long as it follows the diagnosis.
And it's a gradual decline with your diagnosis. It's your disease progression. So, you know, sometimes you plateau out a little bit and then you start a decline again. So think about some of the diagnoses of congestive heart failure, cancer, lung cancer, COPD. Alzheimer's, there's just a unspecified debility where you just, that happened with me with my great-grandmother. She was 101. She was just declining. 101. That's
God bless her.
debility.
God
Yes.
bless her.
Or failure to thrive. There's all kinds of things, but you can start to think about, when is hospice ready? When is the best time? And it could be frequent hospitalizations, weight loss, wounds, loss of appetite,
Changes.
pneumonia, aspiration pneumonia. There are so many things that start that general decline that are, I don't want to say qualifying, but it helps you start to identify that maybe there's going to be a decline to help you.
Okay, I know in my mind what I want for Mom. But is there a list of questions that I could know what I'm looking for, to zero in on
Absolutely.
the high points?
With all the options on the internet, you can go to the National Hospice and Palliative Care Organization website, and it briefly gives you what is hospice, what are questions to ask. You definitely want to have a Medicare certified hospice company. That's a big question to ask. What therapies do they provide? What's the support team? When you think about hospice, it's something that some people know a little bit about, but if they've experienced it, they see all the benefits. So you kind of want to educate yourself before you interview everyone, and these questions are wonderful questions to use for your interviews.
Oh, that's good to know. Good to know. And just because Dr. Smith said use company A, we all have a freedom of choice. So there are many hospices out there, and that's why the interviewing process is necessary.
It's
Take
very
advantage
important.
of it.
Well, and with the patient choice, as a Medicare benefit, you're not always constrained with insurances, being in-network or out-of-network. Definitely, hospice is supposed to be a support, not an additional cost to you. So it's very open. You can say you're on hospice and some treatment comes out and you want to try a curative treatment. You can revoke your hospice services, seek aggressive treatment. Hospice is a gift. It doesn't mean giving up hope. It doesn't mean just throwing in the towel. It means, what is your quality of life? What are your goals? And how can we best educate you with the disease process that you're experiencing?
All right, Kelly, hold that thought. We're going to take a quick break,
Okay.
and then we're going to come back, and I want to hear about Crossroads Ultimate Gift Program.
Oh, I'd love to tell you about that.
So come on back.
On good days or on bad days, Medina County Office for Older Adults is a place where you can go and it's okay to be yourself. My life was topsy-turvy, and I look upon the day I joined Medina County Office for Older Adults as a day when I did a cartwheel and I landed on my feet.
Welcome back to Golden Years. I am interviewing Kelly Rose from Crossroads Hospice. And Kelly, before we talk more about the nitty-gritty of hospices, I want you to talk about your ultimate gift that you give to the patients.
Well, when you look at hospice services, there's things that differentiate. Our president and owners of Crossroads developed a program called the Ultimate Gift. If today was your last day, what would it look like? A lot of times it's celebrating with family and friends. Of course, there can be food. I'm going to give you a couple examples of different ultimate gifts. So you don't have to think about flying to Vegas for the weekend. It's simple things.
You brought Vegas.
We
to
have
the
brought
facility.
Vegas to patients. We had a local university, a patient wanted to fly. She had never flown. And they donated the plane, the pilot, and they flew her and her son over our house. So we're not talking long extended.
Okay.
You know, a lot of times we've had patients go to Indians games, Browns games, you know, Akron Arrows games. So when we ask each person, it's very individualized. Just a couple weeks ago, we had a patient who loved birds. We got her a bird feeder, a book about birds, and she has some vision problems, so we also got her a CD of the different sounds of birds.
That's
So just thinking about, it's very specific to each person. It's not something you can cookie cut. We have a great gal that coordinates them, and she works with the whole team, which a lot of that is in the plan of care meetings, because each team member brings in different parts about the family and the patient, and they think, what could be a really cool thing that we could do for this patient? We had a younger patient that loves superheroes, and we had a staff member that dressed up as Superman for him. And it was just a wonderful gift for this patient,
really?
and it was very moving. And that's the one thing, the power of tears. We have some music therapy. We work with a very talented man, and he plays music. And think about, some of the songs can take you back to where you were, smells in the air, who you were with, and the power is very emotional. I had this gentleman play for us last week, and there was a lady that cried the whole time, but it was good crying for her, you know, and some people love it and smile, and you can feel the vibration. So that's a gift that we also give
That's terrific.
to our patients and some of the facilities that we work with. So if you just think about what's different and what's meaningful to you, a lot of times with hospice, people want to know what's going to happen towards the end of my life. Is there anyone going to be there? And we have a program that's called Even More Care, where we are with the patient when death is imminent, for the family and for the patient until they pass.
And definitely for the immediate family, because they need to grieve, and to grieve with the person right there. I mean, that is
and to
priceless.
help them understand what's happening. Everyone wants to go out of this world respected and dignified. Everyone wants to know that they made a difference and that they will be missed and cherished. And that's what life should be, a big journey and a lot of celebrations.
Oh,
and
definitely.
we want you to have the best hospice experience, just like every other hospice. You know, how do you do that? You talk to the family, you find out what's important to them and where they need help, and you do it.
You had another program just this past summer called
Yes.
Death Cafe. Now, to me, when I read the title of it, I thought, ooh, I don't want to go there. But tell me what that was all about.
This is fabulous. This is something that started in 2011 in Switzerland, maybe a few years before, but just came to the United States in the last couple years, okay? And the whole purpose is to have a open discussion talking about death. What are your fears? What are your thoughts? How can we talk about something to help make it be a wonderful experience? It's not a bereavement or a support group. It's just people coming together, having some coffee and tea, cake, cookies, you know, just some light food, and just talking about death.
How was it received?
It was, so far, there have been 3 that Crossroads Hospice has been part of. Each one is very different.
Unique.
Very unique.
And the people make it.
And the people coming. The first one was probably the largest. There were 22 people there, and they were all different backgrounds, ages. And I have 2 chaplains that facilitate the group to help the dialogue, to, you know, lead the group, but by no means it's a set agenda. Each one forms based on the conversation that comes out. It's not something that we own, or it's a grassroots project, so anyone can host them. There's a criteria on how to run one. And the biggest thing is everyone is going to eventually come to terms with mortality at some point. It's just opening up the dialogue to help them get there and to provide support. And the first one I had was here in Brunswick for Medina County. And 10 people coming, and it was interesting dialogue because we all come with different experiences with death.
And a lot of times too, like when you were talking about the hospice program, people walk into the room and they have their own impressions of hospice. You know, unless you've dealt with it hand on hand, you have a lot of questions, a lot of concerns. Until you go through it, you don't know what to expect.
And that's the best thing about the team, because they are there to support you through the whole entire experience. You know, if you have medical questions, there's a nurse on board, there's nurse practitioners, there's physicians. You know, if it's something that's more about the care, how are you going to help me? Because we do have a lot of people who are caregivers for their spouse, for their loved ones.
Oh, yeah.
And you have to take care of them. And that's why with hospice, there's 4 different levels of care. There's routine, which means you're on hospice service, you have the team that comes together. There's respite. So if you're at home in the community and you are the main caregiver for your loved one, and you just need a little break. Maybe you need surgery. Maybe you just need to have
A day out,
little,
a lunch or something.
Yes,
Yeah.
or, you know, get together with friends. That respite stay can be at a skilled nursing facility, and that is something that is a wonderful break and support for the caregiver.
And
the
you guys
patient.
arrange that?
We do. We work with many community partners. We take care of everything from calling, organizing, and we're working with the family on what their timeline is and their desires of the outcome. Sometimes with respite, they didn't realize they needed it, and our team sees the fatigue, the burnout,
sure.
the frustration, and we say, hey, you know, have you ever thought about respite care? You know, there's also what's called a general inpatient, and we also are partnered with many local skilled nursing facilities. And that's if you just have some symptoms that's out of that need managed. Pain, symptom management is huge with hospice because it's comfort. You know, so if you have restlessness, anxiety, you know, sometimes nausea, vomiting, that is a symptom that can be managed, usually 3 to 7 days. And then there's continuous care where if there's a patient that is just struggling, you know, a nurse comes every day, they come and take care of that symptom as well. And continuous care can happen in a home setting as well. So they don't, you know, need to be in a certain type setting. And we work with all different partners. We work with hospitals, we work with area physicians, we work with skilled nursing facilities, assisted living, group homes.
Collaboration.
Lots of collaboration,
That's good.
because if we're all communicating the plan of care and we're all working together to help, it's a better outcome for the patient and the family.
And no two cases are going to be the same.
Right.
So you're going to have to piece them apart and get the help in there what's needed, or the facility where they need to go.
And sometimes they're the ones who know the patients the best. I mean, we have serviced patients that maybe their family isn't close by, maybe their loved ones have already passed on, and the physician and the facility have been in contact with this patient for years and years and years. So that's how we gather information, help make it a great experience.
So I want you to leave my viewers
Yes.
a good thought about hospice. And what do you want to tell them?
If you're going to have the best quality of life for the time that you have left, hospice is a way to keep you comfortable, confident, and dignified. It's a fabulous gift. I don't know why anyone would want to have a disease progression experience without it. I want everyone around. I
want
want
a
all the
party.
support.
Yeah.
I want it all.
It sounds
Yes.
like a great program. And I think we have to get rid of the mindset that hospice means the end. Because like you said, it could be lengthy and it could be rewarding. And you need to deal with it on the whole family side too. Well, thank you, Kelly, for
Thanks.
joining me on Golden Years.
My pleasure.
Take Kelly's advice, and if you approach that situation, look into it.
Thank you.
Thank you. And you have a good month. See you next month.
In the year 2000, Brunswick's history found a home at 4613 Laurel Road, now known to our community as Heritage Farm. Its mission is to preserve our past and showcase it for generations to come. Our volunteers have worked for decades collecting and archiving Brunswick's transition from a farming community to a bustling city. But over the years, nature takes its toll on historical artifacts and the places that hold them dear. We need your help to keep the memories safe. Becoming a member of the Brunswick Area Historical Society will help generate the funds necessary to keep the farm and the memories alive. Individual memberships start at just $15. Corporate giving starts at $100. And of course, your volunteer service at Heritage Farm is priceless. Join the drive to save our history. For membership information, visit us on the web at www.brunswickhistory.com.